Welcome back to Breakfast Daily on City TV. Please send us a message. We'd love to hear from you. Where are you watching us from? Let's let us know. Wherever around the country. 0550-585832. That's the WhatsApp line. And hashtag Breakfast Daily on all our social media platforms. And if you're watching us, maybe on Facebook or something, just send us a comment. All right? We'd love to hear from you.
Yeah.
All right. Let's talk about a disease that we thought was no longer an issue in Ghana. I mean, we were declared a polio-free nation long ago.
Yeah.
Other countries have actually studied our vaccination programs and emulated them in order to achieve similar goals. But it looks like, at least recently, there's more polio scares cropping up that we need to be looking out for. Now, this is a scare taking place in the northern part of the country. Viral samples, so polio viral samples discovered in some drainage water. Let's take a quick look at this report.
This is the Koblimagu drain, where the polio virus was found following testing of water samples at the Nuguchi Memorial Center for Medical Research as part of a routine surveillance by the Regional Health Directorate. Residents here tell me children play in the drain and fish from the same place.
As you can see the water drainage here, the community children have been coming here to catch fish during dry season. But looking at the water itself is not healthy. So if you are getting fish from here, it means that the fish you are getting might not be good for your health. So due to that, you can get sicknesses, all kind of sicknesses from there because this water is coming from Tamale town. So all the dirt from town all comes from Kuku to Jakara Yili, pass through Koblimagu, and this water is heading to Bomagu, where I live. So when you come here to harvest fish, to go and sell or to go and use, I don't think it will be good for you.
To turn on a bed, Dema Shimbara. To me, a bed, Dema Shimbara, Dagger me berne. Bema Yipierne, Bentunia malaria, Dagre. Anyalgo, Ben Dagren tool and Tai Kaman Binsa, Zanti Bima, the wounded Daria. The numbers are the course, like Bema. What you know, one told bad Dagrama, Zankanata bad manner, Kabzan to Bandiro.
According to the Ghana Health Service, children who have been vaccinated against the polio virus are not at risk, but they express concern over those who may not be vaccinated. We find out from residents whether some of these children have been vaccinated.
Even 9 months, then cry. This is 1 year, 6 months ago. Say, oh, why? That's all fun. No more question, no more honey. What say, be more much from you? It is so much, and I say, oh, say anything, no cost. Answer why.
I actually don't know. And I have not witnessed them taking the polio vaccine before. So I don't know whether they have taken it or not.
The Ghana Health Service says no child has so far been affected. Nonetheless, they are taking steps to avert an outbreak.
We are done with the planning. Tomorrow, our expectation is that we'll be able to get some investigators, some from the community, some health care workers, train them, and then deploy them into the community to be able to do some of these things for us. We would also be picking samples, from the community beyond where the original samples were taken, because we need to know the extent of the availability of the virus within the environment. So all of that will be done, hopefully beginning from Friday, because tomorrow, Thursday, is when we are going to orient the teams and take them through what they need to do when they go onto the field. Now, once we have the data from these investigations, we'll be able to make a decision as to the next steps that we need to take, including carrying out a mass vaccination campaign for polio, and also the kind of messaging we should give out to the populace, so that they can get protected.
There are many of these drains in the Tamale Metropolis and the Sanarigu municipality, which ends up in some of the dams within these communities, which communities rely on for domestic purposes. There's a need for precaution to be taken to avert any possible outbreak within these areas. Reporting from Tamale, I am Dinah Ngwan for City News.
All right, so that's a report by our colleague, Dinah Ngwan, and she's joined us on the line. Dinah, good morning.
Good morning.
Yes, how serious is this threat of polio actually breaking out in Tamale and by extension the northern region?
Okay, so it's not a breakout. It's not a polio breakout. What we do know is that every month the Ghana Health Service conducts surveillance and they take environmental samples from the drains to test to see whether they will see any virus from this drains. And so with this recent one, it's part of the routine surveillance, and the water they collected was from some drains within the Sanarigo municipality and the Tamale metropolis. So the samples was taken to Noguchi, which they tested, and it came out positive that they found some polio virus in the drains. So according to the Ghana Health Service, they are going to conduct some investigation into it to see how widespread it is, because some children find themselves in these gutters. They are open drains, it's not constructed.
Okay.
So most of each water comes out from the earth. And when the rain stops, you find these children in there. Some of them even swim in the water during the evening.
Yeah.
And we have gutters, vegetable farmers along these gutters. And some of them connect their tubes to the gutter, like the drain.
Yeah,
which
to
they
irrigate
pump the
their...
water from. Yes,
Yeah.
to irrigate their vegetables.
Okay.
So it's a sort of concern. And most of these gutters, you don't really know where it ends because it's interconnected. And there are suspicions that some of these waters could end up in some dugouts in some communities, which residents rely on for domestic purposes.
Yeah.
So for now, when I went to the community, I spoke with them, trying to find out whether they knew about the presence of the virus, but it appears none of them even have heard about it. And yes, so it was new to them. And it's also because for now the sample was found in the drain and no person, according to the Ghana Health Service, has contracted the virus. So the thing about it, according to the health service, is that when a child is vaccinated, the child is not at risk, but the child can be carrying the virus and spread to
Others
the
who
other
may not be
children who are not vaccinated. And that is where the care is. So for now, they will be going to the community to take samples of some of these children to see whether they are carrying it, and they also check in their records to see how many of these children have taken the vaccine. And so they will, from there, they will now know what to do, whether there will be a need for a mass vaccination in the area or not.
Now, Diana, correct me if I'm not right, but I thought that the Ghana Health Service has protocol in place where, for all babies that are born through their, the period of going for weigh-ins and postnatal treatments and vaccinations and so on, polio is one of the mandatory ones that they all have to take. I'm not sure if that's the case.
That's the case.
Okay.
That's the case. But sometimes some of the mothers default.
Okay.
And so if the nurses are not able to trace to vaccinate these children, it leaves them exposed. And so that's the reason they think that they are saying they will be doing the investigation to see how many of these children have fully been vaccinated, how many have not. and then they will now decide whether they have to carry out a mass vaccination or there will be the need for a booster dose or something.
Yeah.
But this is actually not the first time the Ghana Health Service is detecting the virus in the drain, because in 2019 there was a detection, and also in the same year a child in Chereponi contracted the virus, which left her paralyzed.
I see.
So it raised a lot of concerns, and so stakeholders responded with a mass vaccination. So this vaccination was done in northern Ghana and Greater Accra.
Okay.
So with this one, depending on the outcome of the investigation, we will know whether there will be the need for a mass vaccination or not.
Okay. All right. Diana, thank you very much. We really appreciate your time and your thoughts on this matter. All right, so that was our colleague Diana Ngon in the northern region there, bringing us this. It's a rather troubling situation that, you know, I'm just curious as to how, well, like she said, I mean, people are, you know, dodging, as it were, the vaccine protocols. So then you'll find that as much as you try and vaccinate everybody, it will not cover every single one, and then, you know, it leaves room for this thing to resurge, you know, and so on. But our colleague Duke Mensah Opoko, who's a parliamentary correspondent, has joined us in the studio. Yeah. Good morning, Duke.
Hello, good morning.
How you doing?
I'm well.
Okay.
We're just hoping the rain doesn't get bad and
I know.
escalate, so that, I mean, we'll have another situation on our hands. That's just my prayer. It should just go slow like it's been going all morning. It shouldn't.
But you know it's not the fault of the rain.
I know, but I'm just, you know.
You're in Subain.
I'm just, I mean, right now, if it should switch from the first gear to the third gear now, for just 30 minutes.
I know. People have barely recovered from what happened over the
2 days
weekend.
ago.
Yeah, I know, but
So that's just my prayer.
So as a side commentary on this one that you're just saying here right now, I think that yesterday was a day that the district assembly should have been out in the streets cleaning and, you know, clearing debris. But guess what? Yesterday I was going home, and along the circle stretch on the way to Achimota, all the debris, especially I saw some around the, you know where the motorbikes are sold, when you're going towards Caprice Junction.
There's a lot of rubbish there.
You know, there's
Even
a
around
lot of
Tiptoe,
rubbish
there was
in
still-
the street. It's in the road, and nobody has touched it. You see, and so for me, I mean, it gets to a point. Even when you hear the president make a call to say, you know, MMDAs, you know, remove structures, it's almost laughable in my head, because I'm like, really?
Even the cleaning.
They are not doing.
How much more going?
How much we're going to remove
demolish
structures?
Maybe. Well, I don't know. I think we should draw their attention to that. That should be under. I don't think it's still under the AMA now. A lot of things.
No, it's the individual assemblies.
Yeah, I think Okankwe North or something. That, I don't know if it's.
You mean that stretch?
That stretch.
Ah, okay.
If it's AMA, they should do something about it. If it's not, then it's another one. They should also do something. But another thing too, the rain is also exposing shoddy work that has been done by contractors.
Yes.
Not too long ago, the Shiashi stretch. You know, there's a part when you are moving from Accra to when you are moving towards Medina.
Okay.
That part, just before you get to the overhead, the footbridge constructed.
Okay.
There's a detour.
Yes.
A bypass that you take through to East Legon.
Okay.
That route, I remember we
he
did
was there.
breakfast daily here.
Yeah,
went there
I
to
went
go
on
and
site
cover
to
it.
go and do that.
When today,
Yeah.
take your time,
Really?
drive to that place. And
Really?
see that route that they closed up
Yes.
for almost 2 weeks
Yes,
Are
I
you
remember.
serious,
to
Duke?
fix.
I passed there this weekend. It looked perfect, and I was just thinking about. I was remembering, you know.
Go past there today.
Maybe you should do a follow-up.
Wow.
Like go there
Go there
again
today, you will see
and do like
the nature of
yeah.
that route that was constructed. It's not less than 6 months. Go and see the potholes. The kind of poor job that was done there. I think that we need to go.
Wow.
I know sometimes when contractors do these work, it takes some time for them to raise their certificates for them. This contractor, if he has not raised their certificate, government doesn't have to pay him. He needs to go back and do the
Do
work.
it again.
The court was closed for like 3 or 4 days.
Yeah,
I remember.
For them to fix
Yeah.
that, it is terrible. It's terrible, coupled with the fact that a lot of the rains brought debris onto the place. So there's a lot of, mud and whatever. And then you see the potholes that have developed. It's bad. It's very, very bad. For a road that's less than 6 months old, we've been shortchanged.
Well, we're still talking about the polio
Yes,
detection in the northern parts of the country.
What do you make of the situation that we find?
First of all, for an arm of the health service that is very under-resourced, and we found out that during the COVID crisis that the public health arm of the Ghana Health Service, one of the most under-resourced arms of the Ghana
Duke,
Health.
hold that thought, because we've got the Deputy Director for Public Health in the Northern Region, Hilarious Abiu, on the line, joining us to talk more about what's happening with this detection of polio. Good morning, Hilarious.
Good morning.
Thank you for joining us on Breakfast Daily.
Thank you.
So we've been talking about the polio scare that's been discovered in drainage water. Okay. Now let's go back to 2019, and Dinah mentioned this when we spoke to her, that there was an outbreak. There were samples detected in the northeast region, and then in Tamale, and then even in Abubuloshi here in Accra, a child was seen to or found to have polio, and then there was this mass vaccination exercise. Now, what does that mean for Ghana? Does that mean that our previous status as a polio-free country has been jeopardized, or are we in some other kind of situation now? Just explain that to us.
Very well. So first of all, the declaration of the country as polio-free, as you referred to, is in respect of what we call the wild polio virus.
Okay.
So polio viruses exist in the environment generally, naturally. Okay. So, and it is from the environment that human beings get infected.
Okay.
So, in terms of the polio-free, it meant that as at the time of that declaration, we've not had anybody who got infected with polio from the general environment, from this wild polio virus.
Okay.
And as we speak currently, we don't have any wild polio virus infection in the country.
Okay.
What we do have is what we call the circulating vaccine-derived polio virus. So these viruses are derived from vaccines. So
Interesting.
we give these vaccines to the children to protect them against polio.
Okay.
Now, depending on how solid your immune system is, you could have these virus, which is in the vaccine and made inactive or made in such a way that it will not affect the person who takes it as a vaccine being excreted in the environment. So you could have a child who has been immunized and the immunity is developed against polio, but is able to shed these, virus in the feces into the environment. So when you have instances of open defecation into gutters, into drains, and things like that, then potentially these viruses can infect the environment. Then, under those circumstances, it becomes a risk to children who haven't had any vaccination against the polio. So the 2019 and then the current instances we're talking about had to do with the detection of this kind of virus within certain environments where we are keeping surveillance on, we are keeping an eye on. So specifically in the northern region, you have 2 sites, one in Tamale Metropolis and then another in Sagnerugu municipality. In these environments, we pick samples from the drains every month and send to Noguchi for testing. The idea is for us to be able to tell whether or not we have these viruses circulating in the environment. if they are, then we need to find the extent of the availability in the environment. One, we need to find out whether all our children are protected against polio. And then we also need to find out whether we have healthy children vaccinated but are excreting these viruses into the environment. And based on the findings, we can then intervene appropriately. In the specific instances of 2019, apart from what was found in the environment, like in Tamale, the same site that we are getting these positive samples, and parts of Agbogboshi, we had some communities now in Northeast. There was a Krachi in Chumuru, in Oti region now, and a few places where they found one or two children who have not been vaccinated against polio, who got infected with the polio. Okay, so the 2019 instance had to do with both positive samples from the environment and a few children who were not vaccinated who got into contact with these viruses. In the specific instance as we're talking now, the positive samples are only from the environment. We haven't had any child yet who has had the infection, who is not vaccinated.
Okay.
Interesting.
Great education,
yeah.
Hilarious.
I wanted to ask you, when you refer to the vaccine, polio vaccine, if found in the virus is found in the feces of a child that has been vaccinated, I would imagine that this virus is supposed to be attenuated. So if that's the case, then how does it become virulent enough to infect another person?
Okay, so the literature makes us understand that if your immunity, depending on the level of the child's immunity or the human's immunity, this is able to mutate.
Yeah.
And therefore become infective.
Okay.
Okay, but then once any child is vaccinated, the immunity develops and is able to get protected.
Okay.
So if that immunized child or vaccinated child gets into contact with this virus, but partly because of the mutation, the virus is not able to affect him, but it is within.
Yeah.
And the child will share it for a period.
Okay.
And that becomes a potential source of spread or in the environment for other children who may be vulnerable or have not been vaccinated.
Okay.
So Hilarious, again, thank you for the education on this. So we have on one hand a sanitation issue, and on the other hand, vaccination cover, and making sure that all the children who need the vaccine are getting it. You did mention, though, that there has not been yet a case that you found of a child being infected, but you have discovered the virus in the water samples that you took. Now, with the last case, because there was a child that was infected, you went ahead and did the mass vaccination. What are we looking at here as far as what you've detected, what the implications are, and any intervention that may be rolled out soon so that we don't have another outbreak of polio in these vulnerable areas?
Right. So immediately we got notification from Noguchi and the Ghana Health Service headquarters that some of our samples are tested positive. We had to activate what we call the Emergency Operations Center. I mean, this is a center that is constantly surveilling our health data to see whether there are any signals of diseases of public health importance emerging. And what they have done essentially is to institute investigations. So we're training investigators who would go back into the community where the drains are. First of all, they're going to pick samples from along the line of the drain, up from higher up from where the initial samples were taken and lower down, because this is a flowing water, to see the extent of the availability within that environment. And that will be sent to the lab again for testing so that we know the extent of the problem. Additionally, our investigators are in the community and they're doing household surveys. In these household surveys, they're trying to find out on the ground whether there are children within that environment and nearby areas who are not vaccinated. because sometimes the data we have in a system may not necessarily reflect what is on the ground. So practically, we want to go look into the households, check the weighing cards, or what we call the maternal and child health records, to see how many of our children are not vaccinated at all, or those who have not been fully vaccinated, so that we have an idea whether we need to quickly get in there and do a mop-up immunization to cover all those children. Then also, part of the investigations will include taking stool samples from healthy children who have been vaccinated within the environment to see whether the children have gotten into contact with this virus and whether they are potential source of the spread into the environment. The outcomes of these investigations will determine whether we have to organize a mass immunization campaign again to try and protect the children who are at risk of getting infected. In the meantime, the message is that mothers with children under 5 who have not been fully vaccinated will need to visit their nearest health facility to get their children vaccinated. If they don't know whether or not their children are fully vaccinated, once they carry their weighing card or the maternal and child health records to the facility, the healthcare worker should be able to determine whether or not they've had the polio vaccine administered to them. But again, the same interventions we instituted when we had COVID, the hand washing and sanitation issues, we need to intensify that, because these viruses are spread through what we call the fecal-oral route, feces to mouth. So once we do a lot of hand washing and sanitation, the likelihood that you can actually pick these things from the environment and put into your mouth, as children would typically do, is reduced.
Yeah.
Okay, and then we call on our metropolitan and district assemblies to try and help us deal with the issues of sanitation, open defecation, as a way of further, interrupting, the spread from the.
Thank you so much. We appreciate your
Most
time.
welcome.
Yeah.
Hilarious Abu is the Deputy Director of Public Health in the Northern Region, and I think he's enlightened us pretty well.
He's broken down the real issues. Yeah.
About the whole spread and what should be done, what could be done. We'll talk more about it after this break, because there's a lot to say. It brings out so many issues.
Yeah.
We'll be right back.
Welcome
back.
Yep. Yeah. Welcome back. Their show is interactive. We've been having a conversation about polio, a polio scare in the Northern Region, and it's troubling on different levels because it speaks to larger issues. Not only should we not be talking about polio in 2022, but really the issues of where polio comes from. It's just dirt. It's filth. It just means you are dirty. That's all it means. You didn't wash your hands, and you put your hands in your mouth after touching some kind of feces, and that's it. That's really what it is, So honestly, we need to do better as a people. The show is interactive. We want to hear from you. What do you think of the conversations that we're having? The WhatsApp line is 0550585832. Do send us a message. Now, Duke is still here with us. Duke, so with all that hilarious Abu was saying and everything else, and the conversation we're having earlier, I don't know what your thoughts are.
I mean, for me, I'm happy. It gladdens my heart that the gentleman on the job, the hilarious, seems to be someone who knows his job. He's on top of his brief. That makes me very happy this morning. Apart from that, if there's something that we should not be afraid of at all in this country, should be polio, because of the significant work that has been done with in relation to polio in Ghana. I remember growing up and seeing all those posters, those boxes. No, they had these boxes that used to store the polio vaccine.
Yes, the vaccines.
They'll move from house to house, immunizing, vaccinating kids and all of that. So we've moved on since then. So yesterday when I even heard them, I said, polio, does it still exist in Ghana? Polio in Ghana, after all the work that we've done. So it's good that they were able to discover it early, because imagine, I mean, even how ignorant the members of the community are about this within their community.
No, but I think he said something very interesting about the wild type, the fact that it exists in the wild by itself. Do you see? And the fact that among the human population, we really don't have we haven't had a transfer to human population. So, but I didn't even know this, that it actually exists in the wild on its own, you know, and it's all around us.
Yes, so they need to, because already Northern Ghana is battling with a lot of issues,
Yes.
a lot of problems.
Yes.
They have, I mean, when it gets, the temperatures rise, they have CSM to deal with, they have meningitis, they have all sorts of things. Just last year there was an outbreak which claimed some lives.
Even yellow fever recently,
yellow
they
fever
said there was an occurrence of that. And you
yes.
ask it, for all these things we think, when you remember they say 6 killer diseases, children. These are things that were in a textbook some years ago that we don't even think about.
But they are still around.
They're still around.
Coupled with the incidence of poverty in our part of the country. So I think it's good that we have from what we've noticed so far, we have the people with the competence. All we need is the resource and the funding. And government needs to give it to them so that a problem that can easily be dealt with as it's been discovered early. We don't wait for it to escalate and then to exact, much more harsher punishment and impact on the people in that part of the country. We need to deal with it quickly.
I think that, again, as we're speaking of air, you know, it also speaks to a more coordinated you know, effort within the ecosystem that we find ourselves. So it's roads. So you think of roads and you think as for those who have cars, but it's not just about that. You know, it even impacts health. You know, and to the extent where poorly constructed roads means poorly constructed gutters, which means, you know, poor drainage, and then you have this kind of filth, and all these things are interconnected. You know, yes, you know. So I think it's important for one well-planned settlement can deal with a lot
so many things.
Properly planned settlement, good roads,
it can
good
eliminate
system.
so many of these things.
Are problems of planning and settlement.
It's
all
true. Okay.
Wow.
Well, still more health issues to discuss, but this time we'll go to the Ashanti region. We're talking about abortion. Now, we know that it's, for some, a controversial topic, but the reality of the situation is that there are a lot of women out there, mainly young women, who seek abortions, okay, for unwanted pregnancies. Now, in Ghana, at public health facilities, it is actually legal to get an abortion. And Duke, you're the one in law school now. I'm sure you can.
What? It's
it's legal.
Illegal.
Yes.
Okay.
You can go into a public health facility and request an abortion, safe abortion. Okay. What we consider safe, done under the correct medical supervision and environment, with the correct tools, with a professional. But we're seeing a lot of women who still go for the illegal option, either because they are ignorant of the law or because of the stigma associated with getting an abortion. And so they don't feel comfortable walking into a reputable facility to request that service. So they go underground to do that. All right, so we're going to go and see what's happening in the Ashanti region, where the number of maternal mortality cases are rising because of this. This is a big contributing factor, okay? So let's check out this report and then we'll talk more.
In Shah Government Hospital, Gavin Watel City News, the practice of having unsafe abortions is very common as her facility has always been dealing with complications associated with such unhealthy practices. She says in some instances it has led to deaths.
We experience most of these things from girls ranging from 12 years to 19 years of age. They are just scared of dropping out of school because of an unwanted pregnancy. And many of them also shy from coming to seek medical aid to get the right procedure done. So they sought out to some pharmacies and herbal concoctions, which later bring about PPH, that's postpartum hemorrhage, and then sepsis. Even most of them can lead to their death. So one thing you're pleading to them is that they should seek for proper medical care, then afterwards to educate them on family planning, which will prevent the many maternal cases we are getting now. We even experienced some from mothers. Someone has given birth to, we had just a recently case there. A mother has given birth to 8 months baby and she got pregnant again. She was afraid about how the society would talk about her. So she just went in for a herbal concoction and came back later with sepsis and then multiple infections. Unfortunately for her, we lost her along the way of treatment.
She further called on the general public not to shy away from seeking appropriate medical care when necessary. Muslim leaders in the Ashanti region are worried about the number of maternal deaths recorded in communities and have thus advocated for the promotion of safe abortion. The office of the Ashanti Regional Chief Imam has called for sensitization of the general public on the practice of safe abortion. According to the PRO for the Regional Chief Imam, who doubles as the program's director for Muslim Family Counseling Service, Mohammed Bunbida, the right procedure of patronizing abortions must be promoted considering the stage the world has reached.
Whether we like it or not, it's unsafe abortion is being practiced. So the only remedy is for us to kind of educate people on the safe abortion and safe abortion care. The reason being simple. Today, the world is a global village, and our daughters practice unhygienic way, unsafe way of aborting, because majority of our girls are engaged in sexual activities, whether we like it or not. Some of them will lead to HIV/AIDS or STDs. Some of them will lead to teenage pregnancy, which lead them to going for unsafe abortion. So I believe it's late, but it's better late than never. So basically, I advocate for community sensitization, community education, capacity building for our faith and traditional leaders to kind of be champions to promote safe abortion. Not in any way promoting abortion in the Muslim Ummah or in the Muslim community. What I'm saying is that in a very serious case like defilement, like a rape, the laws of Ghana give away. And even Islam have a period for abortion, which is 8 weeks. Do you understand? So basically, that is the line I am drawing.
According to the Ghana Health Service, global statistics suggest that 5 to 10% of women die through unsafe abortion annually. As part of strategies to reduce unsafe abortions that lead to maternal deaths, the Ghana Health Service has indicated that it is committed to strengthening safe abortion practices in order to save more lives. The Ashanti Regional Health Directorate revealed that 11 young women died from unsafe abortions in 2021. Dr. Emmanuel Tenkran is the Ashanti Regional Health Director.
Unsafe abortion can be prevented because better ways of doing abortion is there than for unskilled person, somebody who is unskilled, somebody who don't know anything about health systems, or doing something in an environment that is so poor, such a way that these women will go there and eventually they will die from complications of unsafe abortion. So in Ghana, we want to strengthen safe abortion services and then do away with unsafe abortion as one of our key strategies to reduce maternal mortality due to unsafe abortion.
Authorities are further adopting measures to reduce the stigma associated with abortion and to encourage young women to visit the appropriate medical facilities in cases of unwanted pregnancies.
The campaign also will work hard to reduce the stigma, the cultural beliefs, and then other challenges that women face in life that result in their death as early as possible.
All right, so let's talk about this issue of abortions and what's happening with maternal mortality as well. Givens Yeboah is a midwifery officer at the Menchia Government Hospital, and she's joining us now to talk more about this issue. Good morning.
Good morning.
Thank you. Thank you very much for joining us on Breakfast Daily this morning.
Okay.
Okay, well, the first thing we'd like to know is what exactly, you're not a lawyer, but what does the law say, because you practice, what does the law say about abortion in Ghana? Can someone have an abortion legally? If yes, where? And if no, is that why people are going the illegal route and ending up risking their lives?
Okay. So right now, at first it was illegalized, but now it's legalized. So a person can have an abortion at any hospital. But when you have an abortion, the law implies that the police should have a family planning method attached to that. Because you don't want one to have an abortion and come back some few months later with another abortion case again.
Okay.
So in case you have an abortion, you want to have an abortion, it's strictly that you have to do a family planning method after doing it. And it
Okay.
should be done in a proper hospital with a professional care.
Okay. So just to clarify, when you say any hospital, is that private and public or only public hospitals?
For now, the only private hospital I know that do those abortions is Maristo's, but any government hospital does that.
Okay. All right. Thank you for the clarification. So we understand that the maternal mortality numbers, a significant number of the victims are those who have undergone unsafe abortions, and then later, after the fact, when complications arise, then they seek proper medical care for that. Is it that the education really hasn't gone down to women to say that you can actually walk into a reputable health facility to get the procedure done? Or is there another reason why women are going that route to get these abortions?
Okay. As I said earlier, at first it wasn't legalized, so we weren't doing at the hospital. But when we saw it's raising a quite number of maternal mortality, we now thought that it is good that we do it ourselves. So I think the education hasn't gone that much down. People think it's still unlegalized, so they can't do it at the hospital. Okay. And one of the problems also goes with the pharmacists. I think those who sell the over-counter drugs to have a proper law attached to that they can't sell abortion drugs to people. Because most of the women buy those drugs from the pharmacist. And we don't just prescribe a drug for someone like that. We don't know where the pregnancy, the gestational age of it, and even where the fetus is lying, because some of the fetus aren't at the uterus. They don't take proper scans, and they don't check the blood volume of the woman, and they just give her the drug. Okay. So sometimes the women bleed up to death, and some also go to quack doctors who also use unhygienic instruments to do it for them. So later on, before they realize that that's even complicated to certain stages, they come back and sometimes we lose them out of those things.
Ms. Yeboah, how do we get the majority of women to realize that they can actually legally and safely walk into any public hospital and get an abortion done?
We have already started with those campaigns, with those, we go to schools to give school health and give to those adolescents. But I think the media too can play a major part in it by advertising for us. But to do it at the hospital, we have to take it to them and we tell them about it. That if someone is pregnant, the person shouldn't stay at home if the person doesn't like the pregnancy. To come to the hospital for the proper thing to be done, rather than buying new drugs or going to new doctor, which will later bring a lot of complications like renal failure and septicemia, hemorrhage, and other risks. And the last complication is even there.
Yeah. In the Ashanti region where you work, what are the numbers like in terms of those who are actually practicing unsafe abortions?
I think we have a large size of number. A large size of number, like in a year, we can record about, in my hospitals, I record about 150 ladies.
Wow.
Who have done an unsafe abortion. I think it's even more than that.
Wow.
Wow.
Okay.
Wow.
Especially with, and the most alarming thing about it is that, especially done in the adolescent stages, like those from the ages 14 to 18.
Okay, so then it's really there's really a stigma issue, fear of discovery from family and parents and friends and all of that kind of thing. I think that's right.
Because I'm sure, especially in a case of a teenage pregnancy or someone who's younger than 18, they would need a guardian or, you know, someone, because they're a minor, they would probably need to be accompanied by someone who's an adult before they could have that procedure done.
No, now we have an adolescent-friendly center there at most hospitals. Even my place, we have some there. So when you go for students, we encourage them to come. Even some don't know how to don't know much about personal hygiene, like how to take care of themselves when they are in their ministries. Some of them are so naive that they don't know anything about sex. I recently got a 12-year-old girl who is pregnant, and the dad brought the girl. She was already about 5 months old pregnant, but the dad knew nothing about it. He later admitted that she was given a drug to her by the boyfriend, who is much older than her. So I think we should do more of the education and educate them on the sex education and the implications of it when you go in for it or when you get pregnant.
Okay, so Given, sorry, I just want you to clarify. Are you saying that a 12, 13, 14, 15-year-old could walk into a health facility and have an abortion?
Not necessarily the abortion. For the abortion, he has to bring a gardener like his dad or a mom or any place.
Thank you.
But for the sex education, she can come by herself and come for it.
Okay. All right. Now, yes, you talked about stigma and you talked about the availability of the procedure in reputable facilities. But here's an instance where, again, abortion is a very sensitive topic for a lot of people. It's also a religious issue, especially in our parts of the world. Now, for someone who is seeking an abortion, if they go to a clinic or a hospital and the healthcare practitioner decides they don't want to perform that procedure, what happens there? You know, is this something that if a woman requests the abortion, the practitioner has to perform the procedure? Or is it one of those things where the doctor can decide, I don't believe in this, I don't want to perform this procedure, you will have to seek help elsewhere?
No, please. It's no more practice again. We have now trained specialized doctors and midwives for doing those procedures.
Okay. All right.
So if one goes to a place and someone is omitting to do it, she just go to another facility.
Okay.
Okay. Okay.
Interesting.
It could be on one condition, like where it will depend on the gestational age of the pregnancy and the health condition of the woman. That will let it be a little problem. That's why maybe the doctor is declining not to abort.
Okay.
Because sometimes the uterus and the fetus may be not be lying in the right position. So it can be a problem when you remove it. Or if the fetus has grown up to a certain level, it will be unsafe to do an abortion. But other than that, the person has the right to abort it only if she doesn't want the pregnancy.
So there would have to be a medical reason for a doctor to refuse to do the procedure, not because of personal beliefs. Okay.
You can't just do it. You have to first do some medical checkups before you do it for the person. That's why it's necessary to come to a hospital to have it done.
Okay.
Thank you very so much, Givens Yeboah, for speaking to us this morning. Thank you. So this is very interesting because I can't say I was fully aware and apprised of the current situation, you know, before we spoke to her. It's very interesting because, I mean, I would like to see what the law says fully about this.
You host the question of law. So maybe this should be one of your topics. You got to delve into it with Clement and Selom.
Yeah, because it's interesting. So she's saying that all public facilities, as long as there's a doctor there, should be able to grant this service.
Yeah.
And she said also that the only private facility she's aware that does this is the Marie Stopes facility.
Yeah.
You know, I'm not sure what your thoughts are.
It's a very sensitive issue, especially.
Sensitive.
I mean, world over now, the Americans are grappling with Roe and Wade.
True. True.
And what the Supreme Court there wants to do with it, you know, it's a sensitive issue. As far as I'm concerned, and I stand to be corrected, but our Criminal Code Act 29 of 1960 stipulates certain conditions.
1960.
Now you see, 1960.
1960.
Yes, 1960.
Charlie,
That's when
we've
our criminal
moved
code-
62
our
years
current-
forward.
Our current criminal code was. Some of the illustrations they use horses and the rest. I mean, in this day,
In this day and
criminal
age.
code, yes, those are some of the illustrations in the criminal code. 1960. Well, it seems some amendments anyway. But on the issue of abortion, which is in Section 58, there are certain, conditions under which it's perfectly legal. So incest, when there's going to be a fetal abnormality, when it was as a result of rape, when it can cause it can cause physical deformity and it can even affect the health of the unborn baby and all of those are legal circumstances under which abortion can be committed. I think that sometimes when it comes to certain social issues, you need to bring them under the light to be able to track them, and you do that by looking at how you can tinker with the legality or otherwise of it. Sometimes there are issues that if you keep them under a radar, you allow a certain black market activity to fester, which then ends up affecting more people. I think that is a situation which we have. We are still a very conservative society that is not very, very open-minded about a lot of things, including abortion. So it's difficult to have these kind of conversations. Unlike elsewhere, women are forcefully demanding the right as to what to do with their bodies or not. You get that point. But I think it all boils down to having a very open conversation about some of these things, so that as girls and boys especially, sometimes when we have these conversations, it's only about the girls, but the boys too can also. I mean, if a boy doesn't go to do what it will not end up that way. So there has to be everybody has to be roped into this kind of conversation, so that at the prevention end, if you have two adolescents, teenagers, who very well much are aware of their options before they decide to do that, it wouldn't get to the end, or it wouldn't get to the point of abortion, or which may even endanger them. When we all heard about medical situation under which you cannot do that, which may not even be unsafe for the mother and the child. So it's very, very important that we have some of these conversations.
Very, very important. Keep educating our youth, because they will find a way to do what they need to get done.
I'm actually intrigued at the age at which you're
really?
people.
12 years. Sure.
Yeah.
People are doing things so.
9 years.
I mean, I have a 14-year-old, so you start to think about some of these things.
Yeah.
I mean, recently we were having a conversation, and she says, "Dad, I don't know what's happening." I mean, Duke, listen to this. She says, all these racial slurs and sexual innuendos. I can't deal with it, and I'm like, this is the age. It's happening.
Yeah.
It's happening.
And interestingly, our age of consent is 16.
It's 16.
Yes.
Yeah.
It's below the voting age.
It is below the voting age.
So you can legally have sex before voting.
Yes.
It's 16 years.
Yes.
And in Ghana, a lot of people at the age 16 are seen as kids.
Yes.
So we need to think about this.
So for me, this talks to the larger conversation about cohesiveness of our laws, right? Because again, you're saying that somebody is an adult by the time they are 18, but there are certain things they cannot do till they're 21, and then but they're already good to have sex and good 16. To go at 16. You see, so younger. If I don't understand. Think about it. It's almost like we need to be clear about rationalizing
all of these
things. Put it together and let it be rational.
Yeah. And a lot of our laws need reforms.
Yeah.
Our criminal code cannot still be from 1960, and there have been some amendments. As we speak, there are still some amendments that are going on, but we need to have it as we have a new company code.
Some of the amendments for abortion were done in 85. But you think about it,
85
is still
almost
like
40
a
years
lifetime
ago.
away, right?
Look at what has happened even within the last 20 years.
Yes, exactly.
I mean, 20 years ago, there was nothing like WhatsApp, Instagram, Twitter. Those things didn't exist.
Yeah.
Even 10 years ago, some of them. So
20 years
the access to information.
There's too much.
20 years ago,
when 2022, so that was 2002.
So
2002.
In 2000, we're still using Sony Ericsson
and GSM, the one that you put
and dial-up internet.
Yeah, I know, right? Yeah, dial-up calls.
Yeah,
Yeah.
The world has moved at in lightning speed. We can't be run by laws that were made before people even knew what a computer was. I mean,
no, we need to fix it.
It doesn't work. Yeah.
Anyway,
so
okay, let me say
Yes.
good morning to my good friend Kofi Sifa.
Okay.
He works with World Vision.
Oh.
They're doing a lot of good things up north. Last week they were able to drill some boreholes for some people up north.
Okay.
And if you see how passionate he is about. So Kofi, yeah, you are doing a good job up north.
That's nice.
Yeah.
Nice one.
Thanks.
All right, Duke, thank you very much for spending time with us this morning. Well, thank you for joining us on the show this morning. We can get a quick break. Don't go anywhere.
Yeah.
Don't touch the remote.
At all.
We'll be right back.